Okay, so the question is women with PCOS that have irregular cycles and they're not ovulating usually have a gigantic number of eggs. And many clinicians, they don't seem to be aware of this. They call it the metabolic syndrome, and there's a lot of puzzlement in the scientific literature about it. But we discovered it's very, very simple. It's just an issue of the quantity of eggs. You were born with more eggs than average, and that huge number of eggs inhibit the FSH release from your pituitary gland in the first part of your cycle. So you never really do recruit a dominant follicle. Now, Clomid and Femra sometimes help, but here's how they work. Femra lowers your estrogen level, and so it fools your pituitary gland into thinking it should make FSH. And Clomid is an anti-estrogen that tells your pituitary gland that there isn't so much estrogen around, and that will stimulate your pituitary gland to make more FSH. That's how they work. But it's hard to move the needle if you have irregular cycles and huge numbers of eggs. It's hard to move that needle with just Clomid or Femra. Now, I like Clomid. I don't prefer Femra. I don't think that's such a great drug for infertile couples. But we like Clomid, and we use that for our mini IVF all the time. We'll freeze the embryos, though, because Clomid has a negative effect on your uterine lining. Ephemerin won't have that a negative effect on your uterine lining, but it really isn't so great for the eggs. So you've got a conflict between Femra and Clomid. But Clomid can give you very good quality eggs, though it hurts your uterine lining, and so you have to freeze the embryos and do mini IVF to make Clomid worthwhile. But I'm not sure in most cases that Clomid or Femra will move the needle. So the usual approach for PCOS that works the best for their women's health reasons, they should be on birth control pills when they're not trying to get pregnant, 21 days on, 7 days off, so that they don't have a higher risk of cancer later in life, like cancer of the uterus. But when they do get pregnant, they ought to do IVF. And instead of our classic mini IVF, which is with Clomid, in those particular cases, we would do what I call the Denmark mini IVF, which means exogenously giving very low doses of FSH and LH so that we get the best quality eggs, and we can still get those eggs because not relying on Clomid to give an FSH and LH increase, which it may not be able to do because the pituitary gland just might not be sensitized to that because there are so many eggs inhibiting it. So I think for PCOS, the most sure-cut treatment would be Denmark mini IVF. And when you're not trying to get pregnant, for women's health reasons, until you're 40, you should be on birth control pills.